And thank you for being with us for this edition of VaxTalks. We're joined today by Dr. Steve Projan. He is a consultant for pharmaceutical companies, and he works with a company called Beat the Reaper. Thanks for being with us today.
Sure thing, Brad. My pleasure.
Today we're talking about the J&J vaccine. As of this recording, the vaccine has temporarily been put on pause because of a concern of a link with blood clots. Dr. Projan, what is it that we need to know here?
The first thing to know is that the blood clots we're seeing, which are serious in terms of being, cerebral, which can lead to serious adverse events, are also exceedingly rare. The second thing to know is now that we're aware of them, we're in a better position to prevent them or treat them, because there are novel treatments and existing treatments which can help alleviate them. And the sooner that we can alert people who have been treated with the vaccine, who are experiencing adverse events, the better. And I think that that's the goal over the next few days for the Advisory Committee on Immunization Practices, the CDC and the FDA, to come up with a plan forward. That will happen probably this Friday.
And just for clarification here, as of this recording, this Friday would be April 23rd. Well, this is extremely rare. 7 million people have gotten the Johnson & Johnson vaccine, but we know of fewer than a dozen reported blood clots. So how concerned should we really be?
The short answer is not very. Frankly, the benefits of the vaccine far outweigh the adverse events. And coming up with means of ameliorating the effects of the blood clots is really one of the primary goals of this pause that we're experiencing. Keep in mind that for the original two vaccines, both mRNA vaccines, we saw a significant number of reactions, immunological reactions, which is why we now ask people to wait 15 minutes post-vaccination before leaving the vaccination site. So if they have something that looks like an anaphylactic shock, we can deal with that. So the one thing that's happening is we're learning as we are vaccinating literally millions of people every day.
Well, you mentioned the mRNA vaccines. The J&J vaccine is different. What makes it different?
Because J&J, similar to both the AstraZeneca Oxford and the Sputnik V Russian vaccine, is an adenovirus vectored vaccine. Adenoviruses are common cold viruses. Some of the viruses being used are not of human origin, and none of the virus uses are being used as a vector cause human disease.
And if there are other vaccines in the pipeline that use the same technology, the same platform that J&J uses, is it then logical to assume there could be similar issues down the line?
All of the adenovirus vectored vaccines, should they have adverse events, the adverse events will be rare. And the advantage of vaccinating large numbers of people across the world significantly outweigh the negative effects. Plus, the more we learn about how to manage those adverse events, such as dealing with the blood clots, the better off we're going to be, and that the adverse events can be mitigated.
Of course, every day we're learning more and more, but what's going on in this downtime with the FDA and the CDC? What are they trying to figure out?
Okay, there are two things that are going on right now. First, a large percentage of the people who received the J&J Janssen vaccine got it within the last 3 weeks. So it's quite conceivable we will see additional cases of the cerebral blood clots. And so that data is being collected. The second is that we're learning if there are mitigation processes that we can use, such as certain drugs that can be used to treat blood clots, that can be employed to treat patients who display symptoms such as headache and other adverse symptoms that have been observed post J&J vaccine.
It's often said that the best vaccine is the one you can get today. However, if given a choice, should people steer away from J&J?
I would not avoid the Johnson & Johnson vaccine. I would take it if it was an option that presented itself immediately. The thing that makes it attractive is that it's a single dose. It's one and done.
What if you've already gotten the J&J?
You should be cognizant of the fact that these symptoms are something you should report to your physician or even just to the pharmacy where you receive the vaccine as soon as you experience them. And there are actually apps for your iPhone or other device where you can report your adverse events, and mitigation procedures can take place, such as using prescribed clotting factor inhibitors that can really help ameliorate the issues.
But you really do anticipate that the J&J vaccine will become readily available once again very soon?
I will predict that come Friday of this week, J&J's vaccine will be used with certain, I don't want to call it restrictions, certain provisos in terms of what are the right patient populations to use them in.
Dr. Projan, thanks so much for lending us your expertise.
My pleasure, Brad, and you know where to get me.
And thank you for watching. For more information, go to whywevax.org.